Brown.
Thanks very much. Thanks, John. How are you? Good to see you. I'll not be interrupted this time. Can I say what a huge privilege it is to be with you today and to be here with Sarah, my wife, because I wanted to come here to thank all of you for what you do for the National Health Service and for healthcare in this country. I want to thank you for the service you give, for the dedication you show, for the commitment you make to the patients of this country, and I want to thank you most of all for the difference that you make to the healthcare of millions of people. And I sometimes think we don't often thank you enough, because the health service is our prized asset. It's the pride of Britain. It's what we talk about when we go to other countries in the world, about what makes us proud of what Britain does best. All of us as families have experience of the National Health Service. I may say that when I was a teenager, I spent a lot of time in hospital because I got a rugby injury and I had a series of operations. And I first went into hospital for these operations at 16. And I was quite amazed by the National Health Service, because every night at 8 o'clock in the evening, a trolley came round our ward and they started pouring us with alcoholic drinks as part of a legacy that had been given to the hospital over a period of time. And there was I at 16, underage, with all the older patients with cataracts being served Guinness and everything else. But what I remember most about that time in hospital, and I spent a lot of time, was the care of the nursing staff, indeed the care of the doctors, the nurses, and all the staff. And I think every family in the country has their own grateful memories of what you and millions of people over many years in the health service have done. I was at Selly Oak Hospital in Birmingham only a few months ago, and I was talking to some of the wounded soldiers who'd come back from fighting in the front. And I met a young soldier who had tragically lost his leg and had it amputated. And at the same time as he was being treated for what were life-threatening injuries, his wife was also having her first baby. And the care to which the nurses and all the hospital staff went to make sure that at that painful time for the father, but also at the joyous time for the family, they brought the family together and made it a happy occasion for all of them, was something that reminds me it's not just medical care, it's the caring attitude of so many thousands of people who make up our National Health Service that makes the greatest difference to people's lives. And that's why people admire what you do. So I want to thank you for what you do. And when we do these surveys of why people want to be part of the National Health Service, why people want to go into medical and nursing care, there's one phrase that always comes out. And it's the one thing that I think we should be genuinely proud of in every part of the country. People say, I joined because I want to make a difference. Well, you make a difference, and I thank you for everything that you do. This conference today, and I'm grateful to the Health Service Journal and the Nursing Times, and John, of course, for comparing it. It's the first chance I have to speak in his presence without him interrupting me. This conference is a wonderful testimony to facing up to the great new challenges of the next few decades. If we look at the National Health Service, we are celebrating this year, and very proud of it, the 60th anniversary of the creation of the National Health Service. And when the National Health Service was created, there was a huge backlog, as everybody knows, of conditions that had to be dealt with, from spectacles to dealing with dental treatment, to dealing with some of the worst and most difficult conditions that people faced. And now, as we look ahead to the next 60 years, what are we thinking of? We're thinking of great successes. Even in the last few years, cancer has fallen by 10%, heart disease by 40%, some of the great successes of both new drugs and great care. We're also thinking of rising aspirations, people knowing that they will live longer, people knowing also that the treatments that are available to them are far more sophisticated than the past, but also people's aspirations about the kind of service that they get from us in the National Health Service and in all our hospitals and surgeries of the country. People's aspirations are a great deal higher, and people want to know not only that the health service is there when they need it, they want to know, as you know, that the health service is going to be personal to their needs, to take into account their desires, their convenience, and of course also their wishes for the way that they're treated when they're in hospital or when they're elderly and are looking for the National Health Service to be of great support to them. And we're dealing with new problems that we hadn't anticipated in the past. As you're discussing today, like MRSA and C. difficile, it is thanks to you and the work that you're doing that MRSA has fallen by 30% and C. difficile 25% in the last year, but we have a long way to go. And while I know that some of the innovations that are being brought in are controversial, like Deep Clean, while I know also that there's a great deal of money now being spent on the technological improvement of dealing with these conditions, and while I know too that we're going to be screening over time people who come in for MRSA, we're going to also, of course, do a great deal more when people are in hospital to protect them. In the end of the day, the health in infection teams, in the end of the day, the care is really what matters, and it's to you and to your staff and to those people in the hospitals that are managing these conditions. It's to ward sisters and to matrons who can tell the cleaning companies and should be able to tell the cleaning companies that they've got to do better. It's to the ordinary staff of the National Health Service that we rely on to improve patient safety. So at the end of the day, these great issues which involve new technology and these great issues which involve, of course, great expenditure on buildings and everything else, they also come down to the level of personal care that you can give people. And that's why the whole basis of our reforms in the National Health Service are to empower the staff to be able to give the treatment that they want to give in line with what the needs and aspirations of patients are. And I'm very pleased that we not only have Anne Keane, who's a former nurse, as a health service minister, and I know she's been speaking to you today about her experiences both as a nurse and as a minister, but we also have Aradazi, who's a surgeon who's come into the government as a minister in the House of Lords to write the report about how we can move forward after consulting thousands of people in the National Health Service over the last few months. So I want to assure you that the National Health Service in future will be built on a recognition of the challenges ahead, taking into account all the problems that you're dealing with today that need to be dealt with. But in the end, it is about empowering the staff, you as staff and all the people that you work with, to be able to serve, as you see it, the best needs and meet the best aspirations of our patients for the future. I came here only to say this, that we are grateful for everything that you do. There's a story told about Field Marshal Montgomery in a completely different context, head of the army when fighting the Battle of Alamein. And it was in the 1940s in Africa, and he was talking to his troops. And Field Marshal Montgomery was not a very modest man, as some people may know from reading about the history of his life. When he was asked who the three greatest generals in history were, he said the other two were Napoleon and Alexander the Great. But Field Marshal Montgomery was addressing his troops, and he was saying to them, what's the most important thing you have? And some of them would say the kits, and others would say their tanks, and others say their equipment, and others say the guns. And he said, no, he said, the most important thing you have is you. And that is even more important to the National Health Service. The most important thing we have as a country is you. Your determination, your commitment, your energy, your dedication to the National Health Service, your belief that you can make a difference. And if the National Health Service is going to move, as I believe it will be, to being even more successful in the next 60 years, it will be thanks to everything you do. Nurses, midwives, doctors, consultants, all members of the staff, administrators, managers, all those who are contributing to the work of the National Health Service, thank you for what you do. The most important thing we have as a nation is you. Thank you very much.